Next patient, age 73, again a brain pathology which shows cerebral atrophy with ischemic changes. Cerebral atrophy with ischemic changes. I'll pass on the reports, you can have a look. And a meningioma. Meningioma is a tumor in the meninges. Initially, he's been under treatment since 2014, so quite a long time again. Initially, he had headaches, and there was an attack of unconsciousness. The headaches were mostly on the vertex. Better by pressure. He was worse from mental exertion. Eye strain, mental exertion made the headache worse. There was reeling, like a vertigo. There was a feeling as if I would fall forward. So when he was walking, there was a feeling as of falling forward. Like what you get with Parkinson's, right? Lot of weakness. Lot of weakness. He was hypertensive. Dry mouth with lot of thirst. He had mucus in his stools. Sometimes he was constipated as well. Interrupted flow of urine. Interrupted flow of urine. And he had to wake up at night for urination as well. He had a lot of tremor in his hands. He liked very hot food. Didn't mention about any flavors, just hot, very piping hot food. It starts, then stops, again it starts in that way. Sometimes with prostatic enlargement you can get interrupted flow of urine. Right. So his major concern was the headache at that point of time, right? So I didn't have a very big totality, to be very honest. 2014 we had started in this case with picric acid. You recall we have shared this medicine with you quite often, picric acid. Points for picric acid? Exhaustion, yes. You have debility. You have headache from mental exertion. Better from pressure. So even in a chronic case, you can think of picric acid with these conditions, right? A lot of debility, headache, better by pressure. Right? I thought of gelsemium, but he was very thirsty, right? You understand gelsemium is generally thirstless, right? Gelsemium comes close with thirstlessness, with the debility. So we started with picric acid, 200C. We went up to 1M with picric acid. There was a little bit of improvement with the headache, but it kept coming back. Little bit of improvement, but it kept coming back. We changed to Bryonia in 2015, October. Why Bryonia? Headache, better from pressure, right? In a patient who is thirsty with dryness in his mouth. Kotha bolte atkaye na to kokhono? Simple prescription of Bryonia. Bryonia has improved quite a lot up to 2018. Hatta kampe dan hatta beshi? Dan hatta. There's tremor, fine tremor in his right hand. 2018 we changed the plan of treatment to Bothrops. I'm sure we have talked about Bothrops, right, my friends, earlier on. Cases of cerebrovascular accident where there is right-sided paretic symptoms, right-sided paralytic symptoms. three things for Bothrops, if you recall: this vision is affected, this speech is affected, and right-sided paretic symptoms. He mentioned about the right-sided tremors at that point of time. Vision was poor. And whenever you have, if you see the report, it shows ischemic changes as there is lack of blood supply to a particular part. Right? And Bothrops can take care of that as well. Right? Open Bothrops please in Borike if you can. কেমন আছেন? ভালো আছেন তো? অসুবিধা কিছু? এই মাথাটাতে ব্যথা এখন আর হয় না তো? আর এটা পড়ে যাবেন মনে হতো? সামনের দিকে বলতেন যে মনে হচ্ছে পড়ে যাব, সেটা হয় না। If you look in Bothrops, we should expect to find under these remedies symptoms of thrombosis, thrombotic phenomena, hemiplegia, aphasia, inability to articulate. So it can be a cerebral thrombus, it can be a cerebral hemorrhage. Both can be applicable for Bothrops. If you see in the second paragraph, broken down hemorrhagic constitutions, hemiplegia with aphasia, nervous trembling, pain in the right toe, so right-sided neurological symptoms. Either it could be paralytic symptoms, even it could be tremor. You understand what I mean? I repeat again, vision is affected, speech is affected, and right-sided paralytic symptoms or even tremors.
Bothrops works well for arterial thrombosis, right?
Yes, can be, depending on the manifestations as well, yeah.
Does he have speech problems?
No. So the vision and his right-sided trembling was the points. We didn't have speech. You know, if you have even two of the three, you can go with Bothrops. Yes. Please use this medicine, my friends. I'm sure in cases of cerebral stroke or in case of paralysis, you have tried causticum, you have tried plumbum. Go back to those cases, look out those cases, try Bothrops in some of them. Believe me, you'll have very efficient and good results with Bothrops. Right? When your causticum isn't helping you, maybe your plumbum isn't helping you, try Bothrops. If you have these features to go along with it. Yes, he had a report. He already had a report with that. But you understand, generally these cases of cerebral atrophy, they progress or they deteriorate quite a lot as well over time, right? It's been 5 years, he has been stable with that. If you see, they have mentioned in the report that it is something was comparatively stable. So I always ask them to do comparative finding with the previous report, and they said it was stable, right? So that was also one of the points. Initially, I didn't get that degree of trembling. He didn't mention that. As you know, time progressed, he mentioned about that. It was more right-sided. That's why. Initially, 2014-15, when he came to us, headache was his predominant problem, right? That got better in about 2017. So we know Bryonia picric acid took care of that aspect, right? So the headache was not there after 2018. Right. Another medicine, I want you to have a look, please. If you open your Borike for Manganum aceticum. Manganum aceticum. Have anyone tried this medicine? The symptoms of Manganum correspond exactly to what you have with Parkinson's. Open Manganum, please. I'm not telling you that it will definitely help you a case of with Parkinson's. Parkinson's is very difficult to treat, right? But some cases you may have a response with Manganum. To be very honest, the success is very limited with Parkinson's, right? If you open Manganum, why I'm saying Manganum in context with this case? If you look in the extremities section of Manganum aceticum, look in the extremities section, please. It mentions walk stooping forward, tendency to fall forward. So you have those exact features with him as well, right? So at one point of time, I did think of Manganum, right? But you understand a geriatric case can be symptoms of Parkinson's as well, right? But Manganum will have a lot of stiffness. If you look in the extremities section, stiffness in muscles of legs, every part of the body is sore. So a lot of stiffness in Manganum. Peculiar slapping gait, walks on metacarpophalangeal joint, walks on the toes, like you have sometimes with different neurological conditions. So they walk on the tiptoes. You got that, everyone? Manganum? We have another medicine who walks like this. They pick up their feet. You understand what I mean? It's called like a stamping gait. You understand? They pick up and they can't feel that when the legs are falling down. Open your Borike, please. Heloderma. 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 We call that as the stamping gait. You understand Manganum is walking on the toes, tiptoes, right? Like a horse. Whereas in case of Heloderma, so it's like a stamping gait. You can just prescribe Heloderma based on the gait. Walking. Open Heloderma, please, in Borike. It's prepared from, I think, a lizard or something like that. It's a lizard, isn't it? Reptile. Big reptile, okay. If you're there in Heloderma extremities, when walking, lifts the feet higher than usual, puts down the heel hard. So that kind of stamping gait. You got that? Heloderma. You can prescribe just on the basis of gait. We have prescribed Heloderma in the slum clinic just on the basis of gait with fairly good results. Not remarkable, but I'll say fairly good results. Yeah. Because they cannot feel, the impact as well as the coordination is defective. So, they are being higher potencies. Yeah, 200 C, 1M, yes, higher potencies. So gait, please put those two medicines in your clinical tips for gait. Manganum if it's tiptoes, Heloderma if it's walking on stamping. And who walks like this, legs crossed? Crossed gait. You have that in abrotinum, crossing of the legs. You understand? Sometimes abrotinum children may sit like this, even the sitting position, the legs are crossed. Even sometimes when they are walking, crossed gait. You have that to a certain extent in abrotinum. We get some cases of cerebral palsy where they always have a crossed gait. The legs are always in a crossed fashion. They won't, even if the mom makes it straight, they'll still do like this. You have that in abrotinum.
Which remedy?
Abrotinum.
Okay.
Abrotinum. দুর্বল লাগছিল ঠিক আছে. We have gone up to 1M with Bothrops. He has been stable. We generally see him in 12 weeks time because you understand he's been doing stable. So I give him medicines for 12 weeks and he follows up accordingly. Last prescription was Bothrops 1M in November. So we're not doing anything today, we are boosting. Headaches are much better. The tendency to fall has reduced. His debility has improved. Only thing which he has mentioned is the right-sided tremor. But he wants to continue treatment, you understand, for the brain pathology, right? Although he's asymptomatic at the moment, right? We are trying to cover that with the medication, Yeah.